Oh, I know that sound. It's time for the Beer News Report. Welcome to the Beer News Report. Cheers. I got a good response from the trivia show I did last week, so I'm continuing it this week. This is part 2 of the COVID-19 trivia show, and the questions will be harder and the information more detailed. If you can get every one of these questions right, then you must be working for the CDC. So without further ado, let's start drinking and ask the first question. Cheers. What is the infection rate in the U.S. for COVID-19? 0.1 to 0.2%, 2% to 3%, 8% to 10%, or 16% to 19%? The answer is 2% to 3%. Did you get it right? This one was a little tricky because we have increased our testing and the infection rate is changing. I did find one website, healthline.com, that said the infection rate is now 5.7%. And also there was medical news today, which had this broad range of 1.5 to 4.5%. But as of Wednesday, May 13th, most of the websites I researched still had the infection rate between 2 and 3%. I think this will change as we increase testing. My feeling is the current infection rate is too low and it will go up. But only time will tell. All right, let's have a drink. Go on to the next question. Cheers. U.S. mortality rate for COVID-19. 2%, 4%, 6%, 8%, or 19%? Is number 3, 6%. Yeah, this one was a little harder. I had to limit it to the U.S. as each country has a different mortality rate. Look at this graph. All these countries had different mortality rates, and you can see the U.S. has a mortality rate of 6%. But why do we have such a variance? Well, in the case of Italy, they got hit with so many victims that their hospitals were overwhelmed. Some patients didn't get the care they needed and unfortunately died, which raised their rate. Now for the U.S., we started at 6% when Seattle got hit. And then it went down, dipping below 2% as we recovered from the Seattle outbreak. Then New York had an outbreak so large we couldn't come up to speed fast enough and the mortality rate increased. Then Louisiana got hit after Mardi Gras. Michigan had an outbreak. The New York outbreak spread to New Jersey and Boston, and on the West Coast, LA had a big outbreak. All these factors raised the mortality rate as the U.S. was caught unprepared and lacked sufficient equipment such as PPE and ventilators. This is why we are now at a 6% mortality rate. You know, one of the key factors of COVID-19 is its ability to overwhelm hospitals. And for comparison, look at the South Korea chart and notice how flat the mortality rate is. If you remember, they got hit real hard when the SARS virus came out in 2003. COVID-19 being part of the SARS family of viruses brought back these memories and they aggressively attacked it. They had been through this before where the U.S. was hardly hit by the SARS virus. So, having experience with outbreaks was key to the South Korean response. All right, on to the next question. Cheers. Johns Hopkins University shows 2 graphs for the growth of COVID-19. One is linear, the other is logarithmic. Why show the log graph? 1. Log graphs are cool, and who doesn't like math? 2. It's easier for computers to understand. 3. To compress large numbers into a more readable form. 4. Log graphs are the only readable if you're a woodchuck. It's 3. To compress large numbers into a more readable form. How many of you picked the woodchuck just for the heck of it? I get it. He's cute. The best way to explain this answer is to pull up the dashboard from Johns Hopkins University. You may remember this from my COVID-19 show at the end of March. Okay, we are at the Johns Hopkins University dashboard for COVID-19, and I've highlighted the U.S. What I want you to do is go down to the lower right-hand corner, this graph right here, and there's a button on the upper right-hand side of that graph that makes it full screen. So now we can see this nice and big. And this is on linear paper, meaning that each square goes up by 100,000. So you get 200,000, 300,000, 400,000. And what this shows is the exponential growth. So if we look right around March 16th or 17th is when the exponential growth starts. And it kind of ends around the, let's see, that's the 25th. So 25th or 26th of March is when it ends. And then it goes into linear growth. So linear growth means that it grows by the, same amount usually every day, which is about 30,000 right now. And exponential growth means that it increases by usually the same amount. So if it goes by 10, the next day it'll be a factor of 10, which is 100. And then from the next day I'll go to 1,000. So it's really, really fast growth. And what I want to point out is that these numbers are so big now that it's depressing the earlier numbers. So since we're growing by 30,000, all these numbers down here, if they're not in the high thousands, they don't even register. And that's why we need to go to a logarithmic chart. If we go to the logarithmic chart, you can see that actually we started having exponential growth on February 28th. And it continued until about March 17th, maybe March 18th. So before, when we were on the linear graph paper, it looked like it started on the 16th, but that's actually kind of where it ended. And it looked like the linear growth started around the 30th of March. But if we look, the 30th of March is way over here. It has been long into linear growth since then. And the reason why this is logarithmic paper goes up by a factor of 10. So here we have 1, and then it goes to 10, and then 100, then 1K. So what that does is it makes exponential growth a straight line, and that's what we see here. It's just a straight line, and it flattens out if you have linear growth. So this is why we want to have a log graph to really get an idea of where the COVID-19 had its exponential start and growth and where it kind of has it leveled off. And we can clearly see that here. So now you know why we use log charts. Hey, here's an extra trivia question you can ask at your next party if you want to get thrown off for acting like a nerd. Can a log graph ever start at 0? The answer is no, because there's no such thing as log-based 0. It's similar to dividing by 0, right? You can't do that either. Well, that was cool, crazy, and in no way boring. All right, on to the next question. Cheers. What is herd immunity? 1. It's fake news. It should be called herd immunity. 2. Protection from infection by living with a lot of animals, i.e. a herd. 3. Developing a vaccine from a herd of animals, like smallpox from cows. Or 4. When so many people are immune that the disease can't find someone to infect. It's 4. When so many people are immune that the disease can't find someone to infect. Herd immunity is the whole reason why we do vaccines. If enough people have immunity to a virus, it has nowhere to go and dies. That's how we got rid of smallpox and almost got rid of polio. Now, you may have heard of this group of people, the anti-vacciners. They're against vaccinations for various reasons. But the effects of them and their children not getting vaccinated are causing new outbreaks of measles and whooping cough. This is because there's a breakdown in the herd immunity. There are pockets now where the virus can survive and spread. Now, you may be wondering, why do we have to get the flu virus every year? Why do we have to get the flu shot every year? Isn't that a vaccine? Yes, the flu shot is a vaccine, but not in the traditional sense, meaning that, one shot and you're cured. The flu virus mutates so much every year that we need a new flu shot to keep up with the changes. According to the CDC, the flu kills about 12 to 60,000 people each year. The goal of the flu shot is to build up a herd immunity so the flu virus can't get around to infect someone. Currently, about 50% of Americans get the flu shot. That's hardly enough for herd immunity. We need more like 70 to 80% coverage. So now the flu virus can easily get out and about in the US. All right, on to the next question. Cheers. If we don't develop a vaccine, how long until the US hits 50% herd immunity, or 162 million people, if infections are at 30,000 each day? 2 years, 5 years, 10 years, 15 years, or 20 years? It's 15 years. Okay, I put this one in because I like doing math problems. Did you stop the video, pull out a calculator, and figure out the answer? If you did, good for you. I mean, it's real easy, right? You take 162 million and you divide it by 30,000. That gives you how many days it would take, which is 5,000. Well, actually, more than 5,000. Then divide that number by 365, and you get that's the number of days in a year, and you get how many years it would take, which is around 15. Now, consider those 15 years. And if we don't have a vaccine, that means we have to shelter at home for at least 15 years. Well, I mean, obviously, as we get closer and closer to 15 years, more and more people will be able to get out and about because we have a built-in immunity. But, I mean, we can't even go 2 years as shelter at home. There's just no way. I don't even think we'll last 1 year as shelter at home because people need to go out and earn. They got to make a living, right? So there has to be another option, a way that we can modify the way we live and work. So what I think is going to become commonplace is to see people wearing masks and putting on gloves wherever they go. And if you have to go to work, then I think they're going to modify the workstations. Now, currently the way I see it out here in California is they have the open bench system. Basically, it's a table and you just stack computers next to it and you just work. You can touch the person you're working next to. That's how close you are. That's not going to work, right? Because you're too close. The virus will be able to flow between each other. So either we're going to have to spread that out, or I started noticing online that people are doing these tents. They may go back to cubicles, but I'm seeing these tents appearing where people work out of their tents, and that's to protect them from getting the virus. I actually think that might happen. So who knows what the future holds. Anyways, this was fun. Let's go on to the next question. Cheers. Do we have an accurate amount of people tested for COVID-19? 1. Yes, it's good enough for government work. 2. No, everyone needs to be tested. 3. No, we really don't know how close we are to herd immunity. 4. Yes, because once we get the vaccine, we don't need to test anymore. 5. As long as you're drinking beer, you don't need to be tested. It's 3. No, we really don't know how close we are to herd immunity. This one should have been easy, as I have been stating all the problems we have been having due to the lack of testing. Just to emphasize what I mean, look at this graph on testing worldwide. While the U.S. has increased its testing, it is nowhere near where it should be. This becomes obvious in this next chart. This chart shows how many tests are being done to find one COVID-19 infection. We are at the bottom, which means we're only basically testing people who go to the hospital, not everyone out in the community. But not everyone goes to the hospital when they get infected. So we really don't know how widespread the virus is. We currently have our testing up to 300,000 per day, but it has been estimated that we need to get to 1 million per day to fully grasp where COVID-19 is in our society. But think about it. If we're doing 1 million tests a day, we're probably going to have to test about 200 million people. That will take over 6 months, which puts us in 2021. So does that mean we have to shelter in place for the rest of the year? It's a scary thought. So I'm okay with the government if it wants to increase testing up to 10 million a day. Setting that mark is going to be hard because we're not even at 1 million tests per day. But you know what? Keep working at it. Let's make that our goal. All right. On to the last question. Cheers. The government is relaxing the shelter-at-home policy as the number of infections are currently going down. The likely effect of this will be 1. No effect at all. The number of infections will continue to go down. 2. It will go up as more people interact with each other. 3. It will level off at around 20,000 each day. 4. It will continue to go down as we now are prepared for it. It will go up as more people interact with each other. Okay, with this one, the answer isn't for sure. We won't know what will happen until after the shelter-at-home policy is lifted. But the medical community is saying that the number of infections will go up. So let's think about this. If we have, right now, roughly 30,000 infections a day, and we're doing sheltering at home, which means no one's interacting with other people, they're trying to social distance and stay at home. If that policy is lifted and people start going out and about and interacting, even if it's unintentional, there's got to be more infections that will happen. But the question is, how will this affect our nation? How many infections can we have each day and not overwhelm our hospitals? That's why I put that flattening the curve graph in with this question. If the infections are spread out evenly over the whole nation, then maybe we could handle 40, 50, maybe even 100,000 infections a day. But can this be done? I doubt it, because the cities are too densely populated, way more than rural towns, and thus have a higher probability of infections. Only time will tell. Well, as you can see, my beer is almost empty. That means we're at the end of the show. I hope you enjoyed it. Please hit the like button. And always, if you want to get notified, you want to see when my next show comes out, just hit that subscribe button. I'm looking forward to seeing you again. And remember, keep your beer cold and your interests hot. Cheers.